Good evening. My name is Kaleigh Hinton, and today I will be presenting on implementing a centralized social support platform in New Jersey to improve patient outcomes amidst the COVID-19 pandemic. So the study objective for my proposal is to determine if the implementation of a centralized social support platform for adults impacted by the COVID-19 pandemic, specifically in New Jersey, leads to improved COVID-19 patient health outcomes. And so why is a centralized platform for social support necessary? So there's no doubt that the COVID-19 pandemic has caused increased levels of loneliness as well as feelings of isolation in communities nationwide. And there have been several studies that suggest that additional knowledge about the pandemic could decrease levels of stress for those who are feeling highly anxious as a result of the pandemic. And so these people need an improved infrastructure of social support if they're going to make it through the COVID-19 pandemic, as well as inevitable future pandemics that we're going to see down the line. I'm really looking to provide a place where patients and families of the patients can go to obtain stories and experiences of people who are going through similar situations to kind of experience a feeling of community support. So the platform that I'm proposing is basically a website that has a voluntary open collaborative forum design where people can share their health-related experiences with COVID-19, as well as any struggles that they may still be facing in the aftermath of their diagnosis. It's going to include links and contact information for health support, mental health support, as well as social support resources that includes links to latest CDC guidelines, as well as New Jersey Department of Health releases related to the pandemic. So this study is going to be a case control study with ideal recruitment of greater than 500 participants that we're going to split up into two groups. And one group is going to receive our treatment, which is going to be the centralized platform that we've designed. And the other group is going to be the control group, which is going to have access to a platform that is only going to contain current social support resources provided by the New Jersey Department of Health. And so basically we're going to distribute surveys to both groups, study groups, prior to their use of either platform in order to get a baseline of their types of symptoms, duration of symptoms, feelings of anxiety, depression, loneliness, etc. Then after they've used these sites, have had access to these sites for several months, we're going to reevaluate their types of symptoms, duration of symptoms, feelings of anxiety, depression, loneliness, etc. To gauge whether or not our platform has made a difference in any of these mental health outcomes. Some potential barriers that I foresee in regard to the study are privacy concerns of participants as they relate to HIPAA, a potential lack of participation because of the stigmatization that surrounds COVID-19 in certain communities, as well as the lack of funding that could prevent us from obtaining some of the resources that we would need in order to carry out this study.